So in order to assess or in order to see why the snoring happens, we can assess the level of obstruction. That can be done with a CT scan of the paranasal sinuses and other few investigations. So along with snoring, if the patient is getting up from the sleep or if they are getting awakened during the sleep time due to any breathing difficulty, that also should be assessed. So snoring and the apneic or the breathing difficulty at night, it contributes to difficult situations in life. So I would advise you to meet the ENT doctors, especially at Ahalia Hospital, Hamban Street.